Um, this may or may not be that interesting, but let me kind of, you got to kind of let you know some of the things that we're doing. So to give everybody a background, I work for UVA Community Health, which compromises 3 small community hospitals: Prince William Medical Center, Haymarket Medical Center, and Culpeper. We're sort of a separate entity from UVA Maine, which is in Charlottesville. And UVA Maine has, which is where Matthew Meyer, who kind of gave us our talk earlier, they have the University Office of Sustainability kind of backing them. So they have access to like all of these major resources. They've been extremely collaborative, but we're not kind of under their umbrella completely. I don't have access to all the great stuff that they do yet. So about a year ago, literally a year to the date, I'm the medical director of the ICU. We kind of self-induced to do a clinical project every single year. And my clinical project that I gave myself last year was to create and do something sustainability related, because I was an environmental science major in college, and this has kind of always been my passion. So this is what we've accomplished in the past 1 year, almost to the month. So we have created within UVA Community Health an interdisciplinary system-wide sustainability committee. It compromises some providers. I'm the chair of it with our facilities operation person. We have people from supply chain, EVS, infection prevention, HR, communications, some nurses, and it really was a matter of me just emailing people and just being like, hey, I'm starting this up. Are you guys interested? This is what I think we can do to make things better. And I have sort of a core team who really has done kind of amazing work. In the interim, we've also created an intranet page that contains the projects and the initiatives. So again, the main medical center for UVA has sort of this whole sustainability page. We have an intranet page for community health that we created just around sustainability. In the past year, we've created a system-wide recycling program. So we had nothing. It was really bad. People were like shoving their, water bottles in their pockets when they went home from work every single day. And so now we have about 40 recycling bins across each one of the hospitals. And we are currently tracking what our waste is. It's a single stream waste process that we've worked through the county with. So we put everything from bottles, glass, cardboard, paper, everything kind of goes into those receptacles. We did an initiative to increase recycling of batteries, IT equipment, and refurbishing of pulse oximeters across the system. So we put up on the intranet page, you've got an old computer you need to get rid of. This is the process. Please don't throw it out. We'll come pick it up through our supply chain person. And then kind of re-educated about these buckets that you can take the pulse oximeters off the patient, and then the company comes and it gets picked up and they refurbish those. There's a program called the Mercy program that through UVA Maine Center takes expired medical products. We have these gray boxes that we put in all the nursing rooms that have been there, but people were like throwing their stuff on it, and we found, patient blankets on it, and nobody even knew what it was. So we started putting that back out in nursing huddles to say, look, if you have expired products in your supply rooms, please put them in Mercy. Here's why. These things then get shipped to the front lines of Ukraine. They get shipped to areas that are in sort of desperate need. The other thing I've recently done is I have partnered with an organization called Medical Missionaries, which is here in Manassas, Virginia, which is a retired physician from our health system who basically created a hospital in Haiti. And he also does ship containers to Africa. And in meeting with him now, we are going to be kind of streamlining our process of taking expired equipment. It turned out like 11 stretchers that were kind of broken. And when I mentioned it to him, he's like, I'll take them. He's like, because people are laying on floors in the hospital in Haiti and we can use your expired, stretchers. So we're streamlining the process to kind of try and get that stuff out of landfills and get it to some of these programs. We've worked with our anesthesiologist who has been wonderful and sits on the committee with us, and we've completely eliminated desflurane from our operating rooms. And we're doing, he's doing an initiative with the anesthesiologist to reduce the nitrous oxide from our ORs. We are also, which this is kind of a big lift, for those of you who are aware, recycling the OR sterile blue wrap. So this creates an enormous amount of waste, and we have a nurse in our operating room who kind of took this on as a project and started collecting bags of this, and like took pictures of her office. She was just putting them in her office until we could figure out what to do. And like she had wall to wall like trash bags of just OR blue wrap. And so what we're doing now is a couple of different things. We've worked with through EVS, a process of we're going to be able to actually start recycling it. We also partnered, we kind of copied this from the Maine Medical Center, is that we've partnered with 11 seamstresses in our community, and they take the sterile blue wrap and they create them into these like totes, like what you use for the your groceries. And so we're going to make it sort of a, when we onboard new providers, kind of a tag of like, hey, here's your new tote. And, you know, you got this from, you know, UVA Community Health, which is, you know, this is a pillar and a focus for us. So we haven't started that yet, but we have the seamstresses, we have the materials and all of that. So we're going to be sending these cute little old ladies in our community our OR sterile blue wrap. We've also worked with Stericycle to do a red bag waste audit. I have learned a lot. So red bag waste has to be incinerated. It costs about $1,200 per bag to get rid of red bag waste, whereas regular municipal waste costs about $118. So it's a huge cost to the healthcare system. So we had Stericycle come in and they did a red bag waste audit, and we found that 80% of what we were putting in our red bags was inappropriate. So we're planning over the next year to do an education initiative, both nursing focused, pharmacy focused, and provider focused. And then we're going to kind of have Stericycle come back in at the end and say, how are we doing? And track what our red bag waste improvement is after the education initiative. We are going to be eliminating plastic patient belonging bags with reusable ones. And so I just ran home from the hospital, so I brought them with us. So everybody kind of has these like horrific things that my thing is freezing. I don't know if it's freezing. Yeah. So, you know, the patient belonging bag that everybody gets, and it's got the drawstring here. So these are gross. We never want to use these again. So they're cheap. So what we found was we looked online to kind of like these reusable recycling bags. And because of we have a behavioral health where we couldn't have strings where our psychiatric patients can get to them, we needed to find something with that didn't have a drawstring. So it's made of that kind of nice grocery material. And then we're going to get it branded with UVA Health. So then the patients will get this as their belonging bag, and then they take it out and, you know, you got marketing for you as well. So once we use all of the plastic ones in the system, we're working on branding these, and then these will be the new patient belonging bags. The other thing we are doing is, you can see here, we identified patient toiletry alternatives and supply buckets in patient rooms. So this picture right here, I took from walking past one of my ICU rooms. So this is what was going into every single one of our intensive care unit rooms. And it was this horrible big plastic bucket that used to be an emesis bucket, which nobody throws up in anymore. We use these like blue bags. And then the secretaries were getting instructed to fill it with like all this stuff. And I sat down with my nurses and laid it out. And I was like, I want you to make piles of like, what do you always use in the room? What do you sometimes use? What do you never use? Because then once it goes into the room, if it doesn't get used and EVS goes in there, it gets tossed. And so what we did is we're going to be eliminating these pink buckets, and we're looking at little kind of like baskets that can hang onto the wows that the nurses have outside of the room, with just the immediate items that they want. A couple of syringes, alcohol swabs, you know, whatever they need that can fit in the basket. And what we've done in the interim is we've cut this down to like 4 items that the nurses have identified that they need. And so it's really, again, we're going to be bringing it to nursing huddles of just kind of thinking about waste and what are you actually bringing in the room and what do you actually need. And then there's more to come on my next slide with kind of next step. The other thing we're doing is Morrison's is our dietary people. And sorry about that. They are doing what's called the Waste Not 2.0 program, where they are currently weighing their food and looking at how much food waste they have, and they are tracking so that the PARs that they purchase are less each time. So, and we're hoping also through Morrison's to move towards, we phased in some compostable products of like plates and things like that, but we're not completely compostable. We still have plastic utensils. And then I've started to introduce the Climate RX program, which I will kind of get to on the next slide. So let me see if I can do this. Okay, so these are sort of in flux. Some of these we've kind of checked the box on. So those other things are things we've kind of done in the past year. So as of last week, we actually have obtained Practice Green Health membership for all 3 of our community hospitals. So we had our onboarding with them, and then I will be meeting kind of with them separately. So that was a big lift from administration to kind of prove to them, like, this is what we need to do and how do we fund it. And so the other thing we want to do is expand upon our website content. So we send out a weekly newsletter, and I've asked permission to create a sustainability corner. And basically just like a little blurb of, you know, hey, if you run your water while you brush your teeth, these are how many gallons of water you're wasting, you know, just kind of a little 2 or 3 sentence to kind of put it in the forefront of the team members. We're expanding the number of our recycling bins through all our facilities and plan on tracking our percentage of waste recycled. The streamlined process with medical missionaries that I was just talking about, one of the things that we are looking into, which is kind of interesting, is I thought about and I asked them, like, hey, if I open up a central line kit and I don't use the lidocaine that's in it, which I would ordinarily toss, but it's no longer in the central kit, but it's still clean. Or I have 5 syringes in there, but I only use 3 of them. Can you use those items even though they're not still packaged? And they were like, absolutely. So now what we want to do to help them out, again, because they send ship containers, they have deals with Cameroon and some other areas, is to create and do an initiative where, particularly with our environmental services, so if there's a chuck in the room and it's unused, put it in this bucket. We can send it to medical missionaries. If there are a couple of loose alcohol swabs that you would ordinarily have just trashed in the can, put it in this bucket. We can send it to medical missionaries. So that's going to be the next step of this over the next year, so that all that other waste will kind of be diverted to a good cause. We are going to be converting our nitrous oxide over to e-cylinders. So again, I'm speaking to a lot of the experts here, but for those who don't know, I learned all of this. 95% of the nitrous oxide, if it's pumped through a wall, ends up in the atmosphere, where only about 5% gets to the patient. So we're going to be capping off our nitrous oxide in the wall and creating, converting to e-cylinders. And then those will be kind of changed out. We're working on the logistical process. We've identified some of these alternatives to the sterile blue wrap, which I've talked about in the education initiative. So I talked about some of that. The next column over here. So we kind of created this, this is going to be our Earth Day initiative, which we just kind of decided this like 2 weeks ago, because when I asked my administration, what's our plan for Earth Day, it was crickets, which meant they didn't have a plan. So I said, hey, I have a good idea. So me and a couple of our nurses are going to set up some tables in the lobby, and one table will be trying to get nurses to sign up for the Nursing Climate Challenge. And then once we create sort of a nursing subcommittee, we can start doing some of these items about sort of education around decreasing bedside waste, since nurses are such a big part of that. And then I'm going to set up a table with the Climate RX stuff. I've sort of gotten permission. I basically just said, hey, why don't I do it? And they were like, well, okay. But I'm not really sure they know what it is, but I've started wearing it on my badge and I handed out 2 at work yesterday. So I was talking about on ICU rounds to my peeps, and people were like, that sounds like a great idea. So I gave some of those out. The other thing that we're pretty excited about is that we converted our patient curtains in our ICU and procedural areas to these kind of plastic curtains that were thought to be and are cleaner than cloth curtains because they could be wiped down. And they have a life expectancy of about 6 months. But then after the 6 months, they were going to be tossed in the trash. So now, after asking around and then convincing Maine Medical Center, because they converted too, they are purchasing this machine that basically recycles the patient curtains after we're done with them and melts them into this big block that then the company picks up and then makes them into new curtains. So that hasn't happened yet, but we're hopeful that that will happen within the next year. My big lift for this year is to see whether or not we as a healthcare system can transition from plastic isolation gowns to reusable isolation gowns. I'm encountering a lot of hurdles with that. So I don't know if that will happen. A lot of it is around cost, the items, how you're going to wash the items, who's going to be tracking the items. So we're still in sort of the infancy stages of that. We have our pharmacist who reached out to Baxter because we thought this would be a cool project. So Baxter has a pilot program with 2 hospitals in the Midwest about recycling IV bags, which I think, when I think about just how much IV tubing and IV bags. And so these other hospitals, we have reached out to them to become a pilot site. We have not heard back, but we have knocked on the door 7 times for this. So I'm going to keep knocking for this one because I think this would be really, really cool. And our pharmacist who sits on our sustainability committee is very interested in doing this as well. And then we have gotten permission and we are going to be phasing in water bottle filling stages throughout our facility. So we're going to be replacing all the old water fountain stations that have all been sort of blocked off with red tape since COVID. And so nobody's been allowed to use them. So they've just been kind of sitting idle in these walls throughout the hospital. So we're going to one by one create water bottle filling stations. And I've asked our administration for an employee engagement day that we give out, branded water bottles to the team so that they stop using styrofoam cups and water bottles. And then maybe eliminate styrofoam for our facilities, from our facilities. So these are kind of upcoming things for the next year. And then this is a screenshot of what we did for all of our WOWs. So I created this. I don't, it was sort of a, the marketing person said to me, Dr. Ondrush, do you have any ideas of what we should put on it? And I was like, I don't know. Why don't we do this? So we created this for all of our WOWs for subliminal messaging. So every computer in the UVA community health system has this flash up in between the one of wash your hands. And then the next one is live more sustainable. So I was kind of hoping, so this has been up now for about 2 months and they haven't taken it down yet. So I'm hoping it kind of stays up, but this is kind of on every single computer screen and patient station in our system. So they've been small projects, nothing like earth shattering. We, our hospital still spews horrible amounts of waste. I will stop share. But our facilities person is working and has gotten a budget to replace our chillers and to replace, try and do HVAC setbacks and some of the things that I've learned about and I'm advocating for and he's advocating for. But it's been these smaller projects that after about 10 months of begging to get in front of executive leadership, I finally did last month, and our CEO had no idea that any of this was going on. And I presented all of this because basically nobody gave me permission to do this. I just kind of did it. And now it was this is fantastic. We should have you present here. And this is, so I said to them, I want to present in front of the board, because I think if I can get in front of the board, then I'd get real attention and momentum, because right now I have like a budget of like nothing. But it's just kind of been very grassroots thus far. So, I'm happy to kind of elaborate any further, but that has been 1 year. So go team.
Wow. Okay, I would like to hear that all again one more time through and slower. That was amazing. I'm so inspired. I want to respect everyone's time. I've screenshotted the slides, and I know they're not a lot, and I think you've shared them with myself and Samim and Sarah. But are you happy?
I can email them to you guys. Like I said, it's the summary that I had about a 15 minutes to present to my executive leadership, and I had to talk that fast to get it all in. So
I'm an emergency physician, so I empathize with anyone who talks fast, but that was just great content. And I really am inspired by what you've done. And I just want to make sure I've tracked all of the ideas. And this is recorded, so we can all watch it through once again. I have questions I'm going to follow up with you about. I don't know if anyone else has any specific questions that they want to ask.
I can't even, like, it's insane to me that you've gotten all of that done in 1 year. That was years of work that it took me and my program to accomplish, years. And it's just well done. Like, gosh, they're so lucky to have you. my mind is absolutely blown that you've gotten that done in 1 year.
I just feel like every time it just, I'll, without getting like emotional, like I live in Prince William County, and every time I turn around, I see another patch of land just like clear cutted with more townhouses and these monstrous data centers. And it's like, as I'm driving to the hospital, and I just try and not get into that spiral of like, we're doomed. They just cut down like another like 200 acres of trees. No wonder it's, and so I think that like some of this is my call to, like, I feel like I have to do something because I'm just seeing all of this destruction around me. So it just motivates me of just, I've got to try and do my part, because there's all of these morons who are making it so much worse for us. But I feel like this isn't even the tip of the iceberg. Like, I have all of these ideas that if they can just, I told them, I was like, if you could just give me carte blanche, I promise I'll save you money. Just let me do my thing and I'll get it done for you. But I don't want to take credit. A lot of it has been keeping people on task, because we're all trying to still do our job. So like every day that I have off, I'm reaching out to my EVS guy. Hey, have you heard back from Crothall? I'm reaching out to my supply chain person. Just want to circle back around. Did you guys get to connect? So it's a little bit of kind of like being mom to everybody, just because, but not because everybody's doing their full-time jobs. And, these 5 or 6 people, my EVS person, my supply chain person, my community, they're fantastic. And they're like, we believe in it. And just the other thing that I would say, which has made a big difference, and I know there's like 2 minutes left, but one of the things I decided to do at every single one of our meetings, and there's a group of about 20 of us, is that I make somebody email me a picture of their why and why are they doing it. And so we start off the meeting where, here is Debbie's why, and it may be a picture of her grandchild. And so they have to tell them, like, this is why I do all of this work outside of my regular job. And I think everybody, because we all work in sort of these different silos in the hospital, I think it has allowed us to really kind of get to know each other of like, oh my gosh, that's her daughter. Or, one guy in EVS took a hilarious picture. He has a basement office with no windows, but he's got like 5 plants, and his bonsai tree died. And his why was like his bonsai tree of like why he wanted his bonsai tree to live with like all of his other ones. And so it just, I think it's made a difference, and it keeps the team engaged in the work of like, let us not forget what our why is, because each of
Mm.
us are here for a different why.
Yes.
So,
Hey, Joanne, you're doing the front door approach, which is contacting the two hospitals in the Midwest. But sometimes there's a back door approach and or a side door. And I was talking to Sarah about this. This is just take half a second here. They're at the policy level, and I'm talking about the feds. Okay, Department of Health, Humans.
Health and Human Services.
HHS, yeah.
That's it, HHS and HS, Homeland Security, have a joint community, non-federal governmental task force advisory group, which is made up of folks out in the field, both from, and there's two divisions, both from local public health and governmental health departments, and the other arm is healthcare facilities and other entities at large. And I happen to be on that task force, and we are connected nationwide. So when you don't get a cooperative or you don't hear back from your facilities, there's a chance this national group can maybe pull a string, because maybe those same Midwest folks are connected to this committee, which is very possible. Several policies have been set at the federal level that have already come down. They go to AHA, and then they end up in your hospitals as, I mean, there's medical devices and the safety of them, because as you know, everything has a computer chip.